Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, fracture shaft of humerus. Okay. In fracture shaft of humerus, first and foremost, the mechanism of injury of fracture shaft of humerus is by high velocity injury. There is high velocity injury is common in fracture shaft of humerus. So in fracture shaft of humerus, there is fracture of the shaft is present. So here, when there is fracture of the humerus is seen below the deltoid tuberosity. If it occurs below the deltoid tuberosity, that means there is a deltoid muscle which is attached here. Okay, so this deltoid muscle will pull the proximal fragment upwards. So this will result in displacement of the fracture shaft of humerus. So this displacement of the fracture shaft of humerus is the most common complication. So most common complication of fracture shaft of humerus is displacement. This is because of the fragment with deltoid insertion is mainly abducted. Then, the most common nerve injured in fracture shaft of humerus is radial nerve is injured, and if this radial nerve injury occurs in lower one third, then we call it as Holstein-Lewis sign. Involvement of the radial nerve at the lower one third is called as Holstein-Lewis sign. So treatment of fracture shaft of humerus. The fracture shaft of humerus can be treated mainly by we can treat it with the help of closed reduction along with plaster of Paris application can be used. So this is nothing but U cast or also called as hanging cast can be used. So in fracture shaft of humerus, a U cast or hanging cast can be used, and if this closed reduction and internal fixation, fails, then we can do open reduction with internal fixation can be done. In the open reduction and internal fixation, we can either put a plate or nailing can be done to the patient, or we can also put an external fixation can be put in the patient. So these open reduction and internal fixation and external fixation is nothing but the surgery. Okay, so now what are the indications of surgery in the fracture shaft of humerus? So if there is any open fracture, or if there is any neurovascular injury, or if there is any non-union, all these will result in indications of surgery for fracture shaft of humerus.
thank you and thank you for watching.